I think about the journey that I've been on professionally. I think about the journey that our agency has been on. And it doesn't feel like 10 years, but it also feels like a lifetime. Like, like I don't remember life before for all seasons. I can recall like where I was in the past, but I feel like I've been doing this forever. I walked into an agency where there was so much heart and so much help for the community, but we were not a financially stable agency. We were small, and we were really hanging on by a string. Yep. And had it not been for angels like Richard Marks and Amy Haynes and the Dock Street Foundation and Alice Ryan and the Mary Wald Fund, we wouldn't be here today. Between having the help of Richard and Amy and Alice, and then John Valiant and the Grace B. Kerr Fund, that's really where we found the financial footing to kind of reinvent what we had been doing, because we were in a large amount of debt and we did not have a sustainable model. And so to start with this small agency that was just $1 million, but really struggling, and then now here we are 10 years later, a $10 million agency, and we are really strong on our financial footing. It's a whole different ballgame. Yeah. There were a lot of sleepless nights. There were a lot of tears. There were a lot of having to sort of figure out where fear sat next to taking risk and digging in with the community. And some of it was about, offloading some programs that didn't make sense for us. It was about restructuring our staff and hiring an incredible team, because we could not be where we are today without the incredible team that is in place. And that in itself was a journey to find the right people who really could groove and jump on board for all of the ins and outs of growth and change. I mean, I was on the board for 7 years before I came in as the interim executive director. And so my love for the work that I had done was solid. And I am a clinician by training. I worked at the Rape Crisis Center when I was at Syracuse University, and then was able to really dig into just my own social justice piece of who I am. So there was never a time where I said, I don't want to do this. There were times where I wasn't sure that it was going to sustain itself. But I was never in the zone of, well, we can't figure that out. It's always been yes and. Yes, we're going to figure it out, and we're going to do it better. And we're going to learn from the mistakes that we've made or the mistakes that have been made in the past. And so for me, it was really about how do you take the life lessons that you're learning along the way and take a pause to go back and say, okay, if we had to do it again, what needed to be different? And I remember it was probably my 3rd year at the agency, and we had to go through an accreditation process, and it was a new process for all behavioral health entities. And we went out to Las Vegas and had a training, and the gentleman there said, the mom and pop shops that are doing things the way that they've always done things will not be around in 10 years. And I've never forgotten that statement, because we decided then that we were going to do it better. We were going to do it differently. We were going to really dig in and make it that no one has to know a community without For All Seasons, because there's so many things that we provide, and people don't have to think about where those services are going to come from. They just happen. I think we also really worked hard to make sure that we were positioning ourselves outside of the community, really aligning ourselves with the governor's office of crime prevention and policy, spending time in Annapolis, working with our local legislators. It became a much bigger project that was not just about a 9 to 5 going to the agency and going home, but really about positioning the agency in such a way that we looked at the gaps in the community, what made sense for us, what was in our wheelhouse, and making sure that we were staying on the radar screen of the folks who were the funders and the people who might be able to say, hey, you need to look at it this way. Or, I've always said my job is not to be an expert in everything. My job is to bring the experts to the table and let them do their jobs. Yeah. The other side of that is that I had to go and seek expertise of folks outside of our agency to be able to say, and now what? Or here's what we're facing. So, the whole idea of like check your ego at the door, that kind of became the mantra for me when I would sit down at the table with folks, because we all do it better together.
Yeah.
And so if we can come and really sort of shed the who's going to be at the top and really just sit down across the table from one another and say, how do we solve this problem together? That is really what started to separate us in terms of how we showed up at the table.
And the other thing was, which I think really should be highlighted, is the way in which you reached out for partnerships. You brought a lot of people to the table.
Yeah, I mean, we have to have partnerships, and being able to figure out, even where entities might not have been in the position before to say, well, that makes sense. People say things like our Frosty event that we're doing this week, where we're doing a backpack giveaway or a free holiday event. We have to place ourselves in the community where we are showing that we are about more than just the services we're providing behind the door. And so, connecting with our media partners like you and the paper, connecting with Casa of the Midshore, making sure that we're aligning ourselves with the Neighborhood Service Center. All of these entities make a difference. Working with our faith partners, we have to go where people are. We can't expect people to always walk through our doors. The Center for Learning is where we have really moved in the last couple of years to be able to be an educating powerhouse for the community and for our team. So bringing experts from across the country so that we can be training our own staff, making sure that we are doing our own internal training so that we have the highest level of expertise. One of the things that we made a decision on 8 years ago was to trauma certify all of our folks, because we realized that what was walking through our doors was a lot more difficult than the little symptoms that people may have talked about in the past. And so we are the place where it does not matter what the diagnosis is. It does not matter what the experience is. As the Rape Crisis Center, we're seeing some really tough cases. And what we said to our staff was, what do you need? And they said, more education. We need more expertise so that when folks are walking through the door, no matter what they're placing on our laps, we have the skills and tools to navigate it. And so that's where the Center for Learning has really come in. And it also has been a branch where people can request programs and trainings from us as experts. So Lisa Mulcahy, our Chief Clinical Officer, and I spend a lot of our time in the community providing trainings based on our expertise, having worked in the field for 25 plus years. Yeah. People have asked time and again of like, how did you know the kind of leader you wanted to be? And I don't know as though I knew the kind of leader I wanted to be, but I knew the kind of leader I didn't want to be. And so I was able to take experiences and pull from the people who were great mentors of mine. And so my highs were being able to cultivate this environment through our training with Brene Brown and the Dare to Lead, and making sure that we all had a foundation of leadership, and making sure that our team, even though we are going through some difficult things and some hard change, one of the things that we got really good at, and probably the best high, is owning when we didn't get it right and saying to our team, we didn't get it right. We need you to hang in with us. The lows were when we were operating in fear, when we weren't sure that we were going to be able to stay open. We were fearful if folks were leaving the agency to seek other jobs because we didn't have a good sustainable plan in place. And what we've really cultivated now is this culture of, if you build it, they will come. And people have really rallied around the community, and people are seeking us as employers because they know that we care about our people. We've been able to implement self-care models. We've been able to say to folks, here's the information that we have. What else do you need? And the lowest part of the low was thinking about For All Seasons not existing, and that just wasn't a possibility for me. In my mind, this is an entity and a part of our community that has to be in place in order for us to be at our best. I will never be out of a job, and our agency will always have a need. I think that our next 10 years really looks like getting ourselves in the main street of all of the communities. That's really a project that we're working on now to make sure, my goal is that when anybody drives into the communities on the Eastern Shore and visits this amazing place, they see mental health as a priority because they see our offices on the main streets in which they drive. So that's one of our big goals right now, is to make sure that we are not the best kept secret on the shore, but that we are a part of the everyday fabric. And for me, I think the ability to really continue to teach and mentor and help to grow our clinical team and our administrative team so that we are creating leaders who can move into positions. Our job is not just to hire people and leave them where they are, but really be building a culture of sustainability so that there's succession planning in place, so that when one of us is done at the agency in a high position, we've already cultivated the next leader. So that for me is a really exciting thing about where I am in my career, is that I can become a teacher and become a mentor and help to build our next generation of leaders so that For All Seasons has a pathway beyond the next 10 years.